My name is Kat Barker and I am the Senior Sister for Surgical Assessment Unit and Ambulatory Surgical Centre. We use CEMbooks on a daily basis to document things that we need to escalate, so that might be how many patients we've got on the unit, how many beds are in use, what the delays might be, so if there's a delay in moving patients towards for whatever reason, and any safety concerns that we've got, and it's just a really good way for us to document and highlight those things. As a team, it just allows us to take a moment out and think about what the capacity is on the unit, what barriers to patient safety might be, and making sure that we've got something documented to say, A, that we've escalated, and B, what the plan will be going forward.
Hi, my name's Tom Ladlow and I'm the Matron for the Emergency Department at St James's Hospital. So CEMbooks is quite well integrated into my role as matron within the emergency department. I use it a lot for information sharing with colleagues at all levels, as well as passing information up through the escalation processes to our bronze and silver commands throughout the organisation. It's really good for adding messages on there, as well as situation reps, incident reports and any changes that we have in our operational delivery of care within the emergency department throughout the day. So CEMbooks has allowed us to improve our delivery of care within the emergency department because it acts as a resource for our full clinical team around how we access information in terms of standard operating procedures, patient pathways, and how to escalate any issues that they have in real time. With CEMbooks version 2, it's allowed us to really combine our qualitative and quantitative information together. So we now have qualitative data that automatically populates from our ED tracking system, such as our KPIs, our wait for clinician and our time to initial assessment. But we also have the ability to input qualitative information, such as how care is being delivered, what our waiting areas look like, if there are any issues. We also have the ability then to tag different people within the organisation for escalation, so the clinical team could tag me in the post and I can respond to that as and when we have an outcome for their escalation.
Hi, my name is Gina Gutierrez. I am the team leader for the out-of-hours nurse practitioner team for AMS. We have started using CEMbooks a couple of years ago, maybe 2019. We usually used a normal form of end of shift reporting to a group of people in AMS recipients. And since we moved on to CEMbooks, we were able to provide a clearer and narrative reports of reporting and recording of out-of-hours escalations, issues, and concerns across the whole AMS. Yeah, using CEMbooks creates a bigger visibility for a larger group of people. We can actually record all the escalations, issues, and concerns that has occurred out of hours. CEMbooks provide an excellent platform for the day shift to be able to see what happened during the shift.
One of the main things I use it for is submitting logs and sit reps about what's going on in the department. And this is useful so that other people within the management of the hospital know what's happening. It's also useful for me so that I can sort of go through in my head everything that's going on in the department, so it's quite a useful tool to keep on top of things. And it's also useful to look back on what's happening if you do need to look back at events that have happened in the emergency department too. In my professional, CEMbooks has helped in the way that I manage the department. Part of our job as emergency medicine consultants is clinical, as in looking after individual patients and their needs, but actually quite a lot of what we do is leadership and management of the department, and CEMbooks is a really useful tool to enable us to do that.
Hello, my name's Peter Cutting. I'm an emergency medicine consultant here at Leeds Teaching Hospitals. CEMbooks is a really vital tool for the work that I do on the shop floor as a jobbing emergency medicine consultant, but also I have a responsibility within the department to work in risk management. And really for me that allows me to look at the environment that incidents or events that have gone badly have occurred in. We all know that human factors are very important in the way that we approach analysing incidents these days. And it's very difficult to actually do that if you don't have the context of the department when an event occurred. CEMbooks gives you the ability to have live logs that tell you what the department was like and give you a narrative that gives you a feel for what the department was like. It's much easier to explain to people how bad things happen when you have that level of depth of knowledge of the department at the time. So CEMbooks allows me to have a real depth of knowledge of how the department was when an event may have occurred. It gives me information on staffing levels, it gives me information on business of the department, both with attendances coming into the department and also the number of patients who still remain within the department. It allows me to see if there's been a particular case that has taken senior decision makers away from the shop floor and allowed other areas of the department to have less cover. The other thing it really does is it allows it to be really very easy because I can look back at specific dates and times, I can see when events have happened, and that makes it much more helpful for me as an investigator to be able to look back in real time and see what was occurring. And it makes my job as an investigator and as a safety specialist a lot easier. As you're probably aware, there's a new National Patient Safety Investigation Reporting Framework, which is the new standard that the NHS is going to use for investigating incidents across the NHS. In CEMbooks, you will have a lot of information that allows you to populate the way that the investigations are to be styled in the future. There are elements within the human factors and elements within how the department is that's readily available within CEMbooks that helps you populate a report that should be useful as an outcome. So I've been using CEMbooks in our departments for the last 6 years, the last year of which has been the second version. It's revolutionised the way that I've worked, not just in the way that I have been able to provide care on a day-to-day basis, but it does allow me to go back and look at incidents. That has a direct effect on the way that we look after our patients now, because I can look at things in the past, I can then prevent things happening in the future by using the information contained within CEMbooks.
The Innovation Pop-Up can help colleagues who have developed a product or service like CEMbooks to access further opportunities for scale and spread of their particular innovation across various areas. For instance, through working with the Innovation Pop-Up, the CEMbooks team were able to access opportunities to work with the Wyatt Trust and the Yorkshire and Humber Academic Health Science Network to be able to access further opportunities to adopt that product and service into more trusts and access opportunities across the Yorkshire region.